Welcome back. Last time we spoke a little bit about self-pathologizing, and I want to continue that conversation for just a bit. There are two aspects that underlie and extrapolate from self-pathologizing that I want to address. In terms of the extrapolation, a major problem with self-pathologizing is that it often leads to self-medicating and self-prescribing. Self-medicating is the process of using illicit drugs or alcohol in an attempt to mask or mitigate the emotional or physiological symptoms of the underlying psychological disorder, the emotional distress. So people drink, they take pills, they smoke marijuana, they use cocaine, which all in and of itself creates a new set of problems, and it's really a problem wall in front of the problem wall. Over the past 10 or 20 years, that problem has evolved into the quasi-legal realm of self-prescribing. Increasingly, we see advertisements either in the print media or in video, television, on the internet, for various medications which will alleviate our symptoms, help us to function better, help us to feel better, help us to be more present in our everyday lives. The inherent problem within this advertisement campaign is that all too often someone will walk into their family practitioner's office or any of their physician's offices, and they will inquire about one of these medications. They will even recommend or request one of these medications, telling the physician that, well, I have many of these symptoms, why don't we try that? The problem with that is that to some degree it's the blind leading the blind. When someone self-prescribes, they're dealing with limited knowledge base of the medication's interactions physiologically and its specific chemical basis or utilization, and their subset basis, their experience lies with one patient, one naive patient. If they're speaking to their family doctor, that person, well-meaning as they may be, perhaps has prescribed medication 20 or 30 times or 50 times that year. It's not until the client, the patient, enters into a consultation with a psychiatrist that they're actually speaking with an expert who has experience with the medication they're asking about, as well as all of the psychotropic medications and the intermingling of psychotropic medications and the contraindications of the use of psychotropic medications, the side effects and the overall time-limited effects. So really, the choice is that we can prescribe for ourselves, and we have one client, one experience, or we can seek out a psychiatrist, a psychopharmacologist, who may prescribe medication 10 times a day, 5 days a week for 20 years. To me, knowledge is power. If I'm going to see a doctor, I want to find the most able physician for that need. In this case, psychotropic medication, mood-altering medications, anti-anxiety, anti-depression pills, depression pills. I want a psychopharmacologist. In the other direction, in the introspective direction, the basis for self-pathologizing is self-loathing. Self-loathing is an unconscious, ego-driven outgrowth of early childhood traumas, abandonment, neglect, misalignment. The resolution to self-loathing, the work to the resolution of self-loathing, lies only in the realm of psychoanalytic investigation and treatment. We'll talk more next time.